more conscientious as far as the vegetables and, as far as oatmeal, of course, and just different things like that. But definitely being spiritually grounded as well.
I've adjusted my eating habits too. I try to do low fat, do a lot of salads, and increase my fruit and vegetable intake. And for my physical well-being, so I figure if I exercise more, and I love to walk. I'd rather do that than any other exercise. So I walk, and I do overindulge occasionally with things I shouldn't have, but I do try to watch what I eat.
Some women find that exercise helps, in addition to some dietary changes.
I can't do a lot of running, but what about walking?
Walking is one of the most important things you can do to reduce your risk of breast cancer recurrence. We know that women who walk 3 times a week for 30 minutes each day dramatically reduce their risk of breast cancer coming back.
I will give it a try.
There is no one-size-fits-all plan. Each plan is individual. Work with your doctor to find a plan that meets your needs. Talking with your doctors about your concerns and knowing the right questions to ask can be challenging.
My first treatment and my first visit to my oncologist's office, after I sat there for about an hour and a half, and he came in and he just went through the file and just like that and said, okay. And I said, this is not acceptable. You haven't said anything to me. I understand English and I can read, and he got very offended by that. But I told him, no, you need to tell me more. You need to tell me. You need to take the time.
Communicating with your doctor, how do you make sure you're doing this effectively?
I didn't ask any questions, and I wasn't told any more than what they were going to do with me. I still don't know what stage cancer I had after 13 years because nothing was ever explained to me.
There are many ways to get information from your doctors.
If you don't stop them and ask that you have questions, then they presume that you understand. And yes, it becomes incumbent upon the person to go back and do the research and ask those questions.
It looks like we have to initiate the questions that we ask our doctor. Sometimes they're very docile and you have to just come in and be proactive with your health.
Ask questions. Find out everything you can. We have lists of things that you can ask doctors now. Ask the questions before you make a decision so that you don't regret the decision. At least be a part of the decision making rather than allow someone to make a decision for you and you not even know what your prognosis, diagnosis, or anything is. Be knowledgeable.
We'll begin a series of follow-up appointments now. Could you stop at the receptionist on your way out to make a follow-up appointment for 3 months?
Is that all, Doctor? At my support group meeting, I was told that I would receive a follow-up care plan.
We can talk about that at your next follow-up visit.
Doctor, can I have my care plan now? I want to get started on it. I want to know what I should be doing to maintain my health and well-being.
All right, Ms. Rogers, we can discuss that because there are some things that we can talk about for your lifestyle that might also alleviate some of your concerns.
Your follow-up plan of care includes 2 types of information you will want to discuss with your doctor. Medical information and what you can do to stay healthy as a survivor. To get this, the Institute of Medicine recommends that you ask your doctor these questions. What treatments and drugs have I been given? Do I need to seek follow-up care? Will I get cancer again? What should I do to maintain my health and well-being? Even though I survived cancer, will I feel different physically? And now that I've finished my treatment, which doctor is responsible for monitoring my care?
One of the most important things African American women can do is to make sure they have a good understanding about their disease and the treatments that are available to them. Important questions to ask are, what's the best kind of surgery for me? What additional treatments might be needed? If there are medications or other treatments, what are the side effects? Recovery time is very important, and how you can manage to cope all of this with the demands of work and family living. Finally, they need to ask about support that's available to get them through this difficult time.
Express your concerns during medical visits to get the support that you need from your doctors. The PACE system was developed to help patients do just this. PACE instructs us to present detailed information about how you're feeling, ask questions if the desired information is not provided. Check your understanding of information given to you and express concerns about recommended treatments. To get the information you need from your doctor, remember to stay on pace. Your healthcare team will help you get through breast cancer diagnosis and treatment. But as women, we rely on the support, the listening, and guidance we get from one another, our sisters, our friends, and families, and other breast cancer survivors.
When the doctor tells you you have breast cancer, you think you're the only one in the world with breast cancer. But me, that I know that there are a lot of other people with breast cancer out in the community. People you see every day that you don't know have it. And my husband asked me one time, should we be telling people this? I said, yes, we should shout it from the rooftop. Because somebody's going to tell me something that's going to help me. And I'm going to find out something from them so I can tell someone else that's going to help them. You share your knowledge. And that's what I've gotten from Sisters Network, knowledge and the capability of sharing it with others in the community.
Do you guys have any idea how I can get support in this area? And we'll share that piece. It could be financial, it could be legal, but if it's a stress, that is one of the things as a survivor you can't allow to overtake you.
I didn't really receive any outside community support. I had my family, and they were very supportive. My church members were very supportive. I think the best support that I had was a coworker and I were both going through breast cancer treatment at the same time.
It's important because you can see the different women who are being treated in different ways, different chemicals, different chemo, different radiation, and still they sit there at the meeting strong, you know, in prayer and giving thanks for whatever time that they have, that is all a blessing.
The other thing that I encourage for you, and I know that you're already doing it, is that you talked about going to Sisters Network and some of the support groups to find out about other people's experiences and what they've been through as well.